I'm Dr. Randy Franiak, and we'll start the webinar now. Title today is Advancing the Treatment for Leg and Back Pain, and we'll talk about some of the newer innovations out there to help manage pain. A little bit about myself. I'm an interventional spine pain doctor with a couple of different office locations, as you can see there. And certainly, if your problems are due to stenosis, we have some great options now to treat that do not include medications. Next slide, please. So first, we'll talk about what is a pain specialist. We're physicians who are trained to treat these types of pain. And although we treat acute pains, pains that are relatively new, most of what we wind up dealing with is pains that people have had for quite some time, be it months or even years. And the whole goal of our specialty is to try and reduce your pain, make you more functional so you can have a more enjoyable quality of life. And as time progresses, it seems that we always get new and newer types of interventions that we can do to help people. A pain physician such as myself, we do receive advanced training in minimally invasive procedures that can help with your pain and get you back to enjoying the things that you want to do. Next slide. So when we're talking about spinal stenosis and neurogenic claudications, a fancy term we use for that, where when you're upright and walking, you have this pain in your back and it seems to go down your leg. And sometimes not as much pain in the leg, but it can be even like it's the heaviness or tiredness type of sensation that when you sit down, it feels good. If you lean over the grocery cart, it feels better, or just simply just kind of standing and flexing forward, it feels better. Next slide, please. There's lots of different options that are commonly used for spinal stenosis. You know, a lot of times people will just start with physical therapy or some oral medications that seem to help enough. Epidural steroid injections are a very common procedure that we do for this type of pain. Spinal cord stimulation, radiofrequency ablation, and spinal fusion are more advanced techniques, and usually we try to hold off on things like that, particularly for spinal stenosis and particularly with any sort of surgical intervention if we can. Next slide. Let me just tell you that you're not alone. This is a very common pathology, unfortunately, that affects millions of people. As you can see on this slide, you know, the data suggests that more than 14 million Americans are adversely affected by spinal stenosis. This does become more common as we age. And in people over 65 years old, it's the #1 reason why they wind up having spinal surgery. And as people who have this condition know, it seems to progressively worsen over time to the point where it significantly restricts your ability to move, partake in the activities that you enjoy, and really restrict and interfere with your quality of life. Next slide. So what is spinal stenosis? Stenosis just refers to the term narrowing. And so where the nerves pass through, be it in the holes where those nerves come out, circled in red on the diagram there, or in the canal itself, it's just there's just not enough room for those nerves to get out without getting irritated. When the nerves get irritated, then they get red, swollen, and angry, and it's just a vicious cycle because now there's not enough room and it's constantly getting irritated, so it's just always swollen. And the nerves in the lower spine that come out of those holes, those are the nerves that actually go to your leg, which is why you get pain down the butt and legs. Next slide, please. So what is Vertiflex? This is a new procedure that's used for lumbar spinal stenosis. It's minimally invasive. As you can see, we use a small incision to do this. It's outpatient surgery. It takes maybe 20 minutes or half an hour. It's pretty simple in terms of what we're doing. The whole procedure itself, when you look on the right-hand side, you see the purple, the device with the purple legs, if you will. And it's just helping to open up that space in between the spinous processes, those two bones there. And by opening that up, we relieve some of that stenosis. It's a very safe procedure. There have been thousands of these done, very minimal risk of complications. And the biggest thing is it seems to help a lot of people. Next slide. So in this case, you can see there's a diagram or a little movie playing. We make an incision, we dilate, insert the device, and then tap it in place. So then it's holding up that spinous process. Again, there's the dilator going in, deploy the device, and that helps open or distract that area, tap it into place, and that helps keep the pressure off the nerves. Next slide, please. So when you have this procedure, what do you expect? It is an outpatient procedure. You'll go home the same day. Typically, it's done with a general anesthetic. You're asleep for the procedure, but it can be done with there's sometimes a couple of sutures that we put in. Typically, when I put in a suture, it's something that absorbs, that doesn't need to come out itself. You'll want to keep the area dry instead of dry and not take a shower or bath, typically for 72 hours afterwards. And then we go ahead and let you do whatever you need to do after that. For the first 6 weeks afterwards, I will typically put somebody in a brace for a few days or maybe even a week until I see them post-op. And we limit your activities for the first 6 weeks, in particular, any type of pounding activity, as well as anything where you're aggressively twisting. And you can see activities such as swimming, golf, tennis, running, and jogging are things that we really have you not do for 6 weeks or so afterwards. Gentle walking is always encouraged. And there may be some soreness from the procedure itself. It is a small incision, but still we're going through some muscle and ligament there. The soreness typically is gone within 3 to 5 days afterwards. Next slide, please. So what about the results? There's 5-year data now, and it shows that more than 80% of these patients that get implanted really are doing quite well. As you can see, 9 out of 10 patients are satisfied with the procedure itself. And in particular, 75% in that study showed that there's a reduction in the incidence of leg pain symptoms. And again, not always is it just a pain, but that sort of heaviness, tiredness sensation. And again, that's what we're trying to really gear towards. Not so much back pain per se, but the pain that affects your ability to get up and move. Next slide. There are other pain management options that we use. This slide is talking about spinal cord stimulation. For spinal stenosis, this would not be my first option. We tried epidural steroid injections, Vertiflex. But if everything else fails and there's no other surgical options, this would be something that we could consider. It's an implanted device as well. But again, I think for spinal stenosis, this would not be one of my first options. Next slide, please. Excuse me. What about other pain management options? On this slide, talking about radiofrequency neurotomy. That's where we're creating a heat lesion to destroy a segment of a nerve that innervates the joints in the back. Again, that's for a different type of pain. It's when pain is caused by the arthritis in the joints as opposed to the stenosis itself. And this is a good treatment if it's actually not stenosis, but more the arthritis in the back. Next slide. So some frequently asked questions, and we'll kind of go through these here. If I've had prior treatment done, such as a surgery, a laminectomy, am I still a candidate for a Vertiflex procedure? And really, it depends on what type of procedure you've had done. Honestly, if you've had a fusion or a laminectomy at that level where there's stenosis, Vertiflex would probably not be a good option for you. Radiofrequency neurotomy, the RF procedure, that's for the arthritis in the joints. So if the stenosis is still an issue, you're still a candidate for that. Same thing with spinal cord stimulation. Spinal cord stimulation we're often doing for back and leg pains in someone who's already had surgery. And if there's an area of stenosis that was not treated by prior surgery and the spinal cord stimulator is not treating it adequately, Vertiflex may be an option. Does it require an overnight hospital stay? No, this is an outpatient procedure. You'll go home that same day. It is covered by insurances. The recovery time, as we talked about, we kind of limit your activities for that first 6 weeks. And usually I will have someone wear a brace just to kind of remind them not to do things for that first couple of weeks. Excuse me. Will I be able to get imaging done or go through the airport security? Yes, I've had patients who have x-rays, MRIs, and things like that performed after having an implant, and you will get a card that you can keep in your wallet. So if you need to go through airport security, because you will set off the device. Does this restrict your movement? This device is really, it's intended to help open up that area. It doesn't really restrict your movement. No, none of my patients that have had this done really complain about any restricted movement. Does it relieve pain immediately? And this is another really good question. Oftentimes when we see the patients post-operatively at 10 days or 2 weeks or so, most people say, yeah, I've noticed the difference, and it does seem to get better, but occasionally it's a few weeks before people really say they notice a big difference. So sometimes it can take a little bit longer, but as I always say, life's a bell-shaped curve. And so sometimes people respond more quickly. The bottom line is, we always want to see how many, we want you to be able to respond. So that's why we restrict your movements for those first 6 weeks to give everything the opportunity to work better. Next slide. All right. So here's some folks doing the things that they want to do and trying to get back to enjoy their life. And that's what the whole goal of any interventional procedure that I do is, to provide you with pain relief and make you more functional so you can enjoy things. Next slide. All right. I'd like to thank you for watching the webinar today. I'll certainly hang around here and see if anyone has any questions that you want to submit through the chat.